It's been great to welcome Claire Fuller and Tim Briggs to North Central London today to talk about our test sites programme. It's a really interesting opportunity to ascertain what the gap is between demand on general practice and the resource that's available to them, and one of the most critical pieces of work that we're doing in general practice at the moment. Our PCNs are really engaged, and so are the wider PCNs in North Central London that are not part of the test site programme. I think this is a challenge that everybody wants to solve. Everybody wants to see strong and sustainable general practice across the country, so it's a really exciting piece of work.
Yeah, so Tim and I are doing a tour this week, travelling around all the 22 PCN test sites around the country. And today we're in Camden, but the North Central London, visiting and meeting with the 3 PCN leaders from that and looking at the data. So the point of the pilot is actually to improve the data quality that exists in general practice, and in particular to look at what demand, how you actually match up better the demand capacity gap. So I'm delighted we've got Tim with us, because actually what is underpinning the pilots is actually the use of data to improve services for patients, which is at the heart of the GIRF technology.
Yeah, so I developed the GIRF methodology at Stanmore, where I've been a consultant for over 30 years, in about 2010-11, where we got data together on every single hospital in the land, on orthopaedics, and then tested whether the methodology worked by having a clinical conversation with data to reduce unwanted variation and improve outcomes. It was so successful that it's now gone across 43 specialties, so we know what good looks like, and now we're leading the elective recovery across the NHS, using the data both at trust level and at system level, is giving us the productivity efficiencies by just doing things smarter and better, and allowing us to suggest new ways of working like the surgical hubs. However, if we're going to get the gains we need to really join up primary and secondary care. And I've been wanting to do this programme since we did the pilot in 2019, and having Claire leading this and supporting her, I think we've got a really good chance now of bringing it all together and making it a much more seamless service between primary and secondary care, which will benefit all our patients.